You are watching the Doctalk show. Cut out unhealthy habits like smoking and drinking alcohol. Smoking and drinking are extremely bad for your health and directly related to increasing your non-communicable disease risk. Smoking increases your risk of heart problems, increased blood pressure, cancer, diabetes, and breathing problems. Not drinking is perhaps the best possible health choice you'll ever make. You are watching the Doctalk show.
Hypertension or high blood pressure is a disease that does not discriminate. It affects anyone regardless of your, for example, your social status, your income or wealth or area of stay. We have learned that people who stay in urban areas or in cities have an equal chance of developing high blood pressure as someone who stays in the rural or in the village setting. So I want to discover more, to learn more about these risk factors that make someone more at risk of getting high blood pressure. We'll start with our senior cardiologist, Dr. Lugero. So before we went for the break, we were discussing a bit about the causes of the risk factors. Maybe we can now dive into a bit more detail to understanding more about how these risk factors contribute to the high blood pressure. So you mentioned something about a type 1, an essential high blood pressure, and it has no cause. So does it mean everyone will get high blood pressure in this case?
So there is a risk of developing high blood pressure of about 10% as one ages.
As one becomes older.
You become older and older and older, your risk of developing hypertension increases about 10%, when you cross the age of 6 and above.
Okay.
However, there are lots of risk factors that underlie that possibility of developing high blood pressure. And one of them is, of course, age, like I've told you. Because as you grow older, your blood vessels change. They become stiffer and they are not able to adjust very well. Because as your heart contracts, your blood vessels should be able to adjust very well.
They should be like flexible in a way to accommodate.
As you grow older, they become stiffer, and the heart requires a lot of force to push blood through those stiffer blood vessels. So you realize that your chances of developing it are higher when you grow old.
Okay. Regarding this weight, is there a particular weight cutoff where you say now we're definitely at risk of getting high blood pressure?
Absolutely. We usually use body mass index, but though body mass index doesn't work for everybody, you get the point. Body mass index would work for somebody who's not an athlete, but for athletes we usually use what Dr. Lugo was talking about, the waist circumference.
The waist circumference.
Circumference. To get BMI, we use your weight divided by your height, and your height should be squared. And we expect the normal to be between 18.5 to about 24.9.
That is the normal range of a BMI.
In other words, that's what your body should carry. If you did your weight, if you did a calculation, a simple calculation, you did your weight, divided it by your height, and the height is squared, and the height should be in meters. And then if you get anything between 18.5 and 24.9, it's required to be normal. You're normal.
Okay.
Now, if it begins to exceed, say from 25 to about 30, then you're beginning to be overweight. And if it exceeds 30, maybe to 35, then you're obese. You get the point. Now, what is happening here is that your skeleton was designed to carry a certain weight. But for body mass index, it's only used for people who are normal, people who are not athletes. Now,
so for athletes, what do they use?
For athletes, we've come to realize that they could have a higher BMI, and yet ideally it's only muscle. They have a lot of muscle about them because of the exercise that they do.
Okay.
So for athletes, we decided to use, we use waist circumference. Waist circumference, basically we measure how, Dr. was talking about, we measure from the umbilical and then measure, your waist passes around the umbilical, the navel, and then around. So if it's anything about 108 and above, then for a man is obese.
That is obesity.
You get the point?
Okay.
And for a woman, if it's about 88 centimeters and above, then that woman is what? Is obese.
Okay. Dr. Ogeru, are there some complications that come with this high blood pressure?
One of them is actually stress.
Okay.
And you know what happens is there are lots of reasons why people get stressed. You know, at your workplace, at home, finances, illnesses.
It's like it's a part of life now. Stress is everywhere.
Life, you know, you cannot avoid stress. Right. But what sometimes people do when they get stressed, they eat more.
Absolutely.
They take alcohol, they smoke cigarettes, they engage in lots of unhealthy behaviors.
Yes, right.
So stress, many people react to stress by doing many unhealthy things. Of course, the other things is about alcohol and cigarette smoking, and of course, what constitutes your diet. We would encourage that people take less of sodium and more of potassium.
Okay, so sodium, where can they get sodium from?
So we want you to eat less of sodium, and most of the natural foods contain little sodium.
Okay.
Much of the processed foods, they actually contain too much sodium. We normally talk of what we call target organs. The pressure targets lots of organs in your body. One of it is the heart and blood vessels. So in the heart, you actually get what we call heart attacks. You can get what we call heart failure. You've seen many patients, presenting with difficulty breathing, body swelling, and they cannot do anything. We normally call that heart failure. It is also possible that in your blood vessels, because what pressure does to your blood vessels, it makes them weak, and therefore there are some bulgings or swellings, which we call aneurysms. So when the pressure really raises, those aneurysms can actually rupture, and normally the outcomes are not good. You also have one of the other target organs is your brain. You've had people getting strokes. Strokes are better prevented because treatment is really, really difficult. The other issue that you can get in the brain is memory loss. You can actually get a condition called dementia from hypertension. The other complication is actually to do with the kidney. One of the common causes world over of kidney failure and requirement for artificial treatment like dialysis is actually high blood pressure that is poorly controlled.
High blood pressure is a silent killer, and if you don't go check for it, you can never know that you have it. It may be unfortunate that the time you recognize you have it is when you're suffering from a complication, which can be as devastating as a heart attack or a stroke. So I want you to be more cautious when dealing with this silent disease of high blood pressure. So more about high blood pressure to come after the break. Remember, you can send in your comments and your questions on our social media platforms. You can interact with our doctors. Always happy to respond to each question that you put forward to us. Don't go away. Stay tuned.
You are watching the Doctalk Show.